And hello and welcome to another segment of DSU Inside Perspective. I'm Carlos Holmes, and this is the show where we talk with faculty, staff, students, and guests about some of the things that are going on in the world or some of the great things that are going on here at the Delaware State University. Today we're going to talk about something that is of concern to the whole world, the Ebola virus. And today I have with me Michelle Fisher, who is our Director of our University Health Services. Welcome, Michelle.
Hi, Carlos, and thank you for having me.
And also, we have a new administrator here at Delaware State University, Michelle Shorter, who is our Chief Risk Officer, a new position here at Delaware State University. Welcome,
Thank you,
Michelle.
Carlos.
We have two Michelles here today, so I'm going to call her Miss Fisher and I'm going to call her Miss Shorter. Michelle, what is this Ebola? Let's not even, trust that everybody understands what this illness is. What is this?
Ebola is a viral infection. It is highly infectious. What the experts are saying is that it is different from most viruses in that it's not highly contagious and that it's not airborne, but spread through contact with body fluids of a person who has Ebola.
But it seems to me that we are still, everybody from the local level to our greatest health experts, including those with the Center for Disease Control, the CDC, they're still on a learning curve concerning what this is and what the ramifications of this disease are for the whole world. Is that correct?
That is correct. As you know, Ebola originates from West Africa, the West African region, and it is fairly uncommon in the United States. So as we are now faced with the fact that we have cases in the United States, we are learning as we go on how to deal with this illness.
Now, as Chief Risk Officer, I mean, certainly this falls under your area, the possibility of some type of illness that could infect our population. As far as we know, at this point, there's only been a couple cases in Texas that were apparently the result of somebody that flew into Texas with the illness that subsequently died, and because they cared for them, they got the illness. And they're dealing with that now. Should we be concerned here in Dover, Delaware, here at Delaware State University about this illness?
So I think that's an interesting question. When Michelle and I started talking about Ebola in early August, we really wanted to weigh what was unique to Delaware State University that may make our risk to Ebola exposure a little bit different than the general population. And we've weighed several things, whether it was faculty that may be traveling to the West African continent or students that may be returning from home to campus. And we talked about these things, and we didn't necessarily believe that there was an immediate imminent risk to the university, but we did want to be proactive in making sure that we planned effectively to mitigate any risks that may come across our desk as students came back to campus.
So you guys have really been discussing this and really trying to think through this thing for several months now.
Yes, that is correct.
And you talk about certain characteristics of Delaware State University, and you talk about, we have quite an international population
Correct.
here. Last I checked, it was 250 international students here. From what I understand, we have 10 students from the West African region. That's the latest statistics I've gotten. What this brings to rise the issue of students traveling. Only Lord knows who they're coming in contact with when they go abroad.
Right.
And then they come back here. And if one of those unknown people that we don't know about has Ebola or has been infected with that virus, that person could be bringing it back here. What is the university doing or what are they talking about in terms of what we need to do to protect against that particular scenario?
Well, one of the things that we've always done at the university, the two departments, the Student Health Services and the Office of International Affairs, always communicates on a regular basis regarding student travel, our students that are coming into the country or leaving the country. So we know who our students are. If they're coming into the country for the first time and coming to the campus for the first time, they are referred to the Student Health Center, and we meet with all of them and evaluate their health risk. What we put in place in addition to that, with the since the onset of Ebola, we have been interviewing students' travel history. So students that we were informed had traveled outside of the country and maybe to one of those areas where Ebola is prevalent, we have put additional screening questions in place to identify who they are and put out educational material so that they would know what their risks were, how it's transmitted, and what the symptoms are, and also ask them to monitor for 21 days. Now the good news is we didn't have any students that fell into that category.
Okay. So our risk level is really low at this point.
It is low, and I would say, just to emphasize on what Michelle was talking about, we actually benchmarked an interview process that was being leveraged at multiple universities. And it actually assisted with classifying whether the students were low, medium, or high risk for exposure to Ebola. And I guess the general consensus has been that the students are low risk. So we, at this time, don't feel that we have any high risks for Ebola exposure at the school.
Okay, so now you're working very closely with the State Division of Public Health?
Yes. Communicating with them quite often in the past couple of weeks and months, and also just going to their website, going to the CDC website on a daily basis and getting updates so that we at least stay abreast of the information that is out there.
Okay. Michelle, your position as Chief Risk Officer, goes beyond this particular issue, and this is a very important issue. What other areas of risk are you concerned with?
Risk looks at a wide variety of risks that may impose some type of negative impact to the university. We have risk and safety, for example, where we look at anything that could cause bodily harm or physical damage to the university. We look at strategic risks, ensuring that we're making decisions that support the university's strategic plan. We have, I would say, informational risks, like information technology. And there's just a long list of things that we look at. And mainly my position here is to be a partner to the university and just make sure that we're on the front end of identifying risks and being proactive in putting measures against them.
Which is what this sounds like you're doing with Ebola right now, is trying to stay on the front end of it. Well, I commend you both for your getting out in front of this, and I feel safer as an employee of Delaware State University, and I hope that our other employees do too. So we'll continue learning about this Ebola virus as we go along, and hopefully we won't have to learn about it too intimately here at Delaware State University. Michelle Fisher, Michelle Schroeder, thank you for joining me for this segment of DSU Inside Perspective, and thank you for joining us. We'll see you next time.